If everything else appears fine, is your T3 low? This could indicate that you have T3 syndrome, in which case treatment will be ineffective if administered in the same manner as for a patient with hypothyroidism. When it comes to thyroid conditions, there are two common misdiagnoses and misconceptions: hypothyroidism and low T3 syndrome. To start, T3 syndrome is defined as the inability to convert T4 into T3. Thyroid hormone is responsible for producing T4 that is released from the thyroid and enters the bloodstream where it must be converted into T3. This occurs in many different cells throughout the body, and many people have T3 syndrome, which is the result of the T4 conversion not happening to T3. T3 is what is actually active on the cells. It sends a message to the mitochondria instructing it to perform its function inside your cells. As a result, you may have high levels of TSH and T4, but not the T4 to T3 conversion, which will result in all the symptoms of hypothyroidism, such as fatigue, the fog in the head, the constipation, memory loss, etc., and they are frequently misdiagnosed. Now, if your thyroid is checked by a regular doctor, and it turns out that you have T3 syndrome, what will the regular doctor do? They will order a TSH. Occasionally, they will order a free T4. After they get your blood back, they will say something like, "Hey, your T4 looks fine, you don't have any hypothyroidism." In other words, they aren't really diagnosing T3 syndrome because they never check your T3 or your free T3. This means that even though you may think you don't have hypothyroidism, you actually do because T3 isn't entering cells and stimulating mitochondria in an effective manner. You might search online and find that, although your doctor says you're fine, you actually have all the symptoms of hypothyroidism. This is because rarely do regular doctors actually check for T3 syndrome. Instead, they assume that everything is fine if the TSH is normal, which is far from the truth about the thyroid and results in many misdiagnoses of T3 syndrome. If you're lucky, you may have a doctor who does check for T3 syndrome. So how do they actually treat this? Your usual physician will treat it in the same way as if you have low T4, which is the source of your hyperthyroidism. They will look for low T3. However, they genuinely don't want to provide you with any T3. I'm not sure why, but they will offer you Levothyroxine or Thyroid. Very few of them will give you anything else. Even rarer, some of them will give you a glandular supplement called Thyroid, which has T4 and T3 and looks nice. However, the majority of the time they'll just give you a T4 and say, "Hey, you're going to convert enough of that to the T3. Everything will be fine." Let's talk about what causes T3 syndrome and other forms of hypothyroidism. For other forms of hypothyroidism, the most common cause is damage to the thyroid gland for whatever reason. It doesn't really work out that way, though. You don't get a lot of the results that you want from Thyroid because you're not getting that T3, which is actually doing stuff right. That's usually what happens if you go to a conventional doctor, and they even do see your T3 is low. T3 syndrome is different. You make enough T4, your thyroid is functioning normally, but you are unable to convert that T4 into T3. This is typically related to nutrient deficiencies, such as a deficiency of iron, B12, zinc, selenium, or even a small amount of vitamin C, radiation exposure, pesticide or herbicide exposure, low iodine, and many other factors can cause your thyroid to malfunction and prevent you from producing enough T4. These are some nutrients that are really important for you to be able to convert your T4 to T3 effectively. However, you could also have simple chronic conditions such as an autoimmune disease, multiple chronic infections, heavy metal exposure, etc. These chronic inflammatory states can also make it difficult for your body to convert T4 to T3, as I frequently observe in my patients with chronic diseases. These patients frequently have problems converting T4 to T3, which we need to address. For example, let's say a patient comes into my office complaining of fatigue, constipation, and brain fog. I work with them to address these issues. I say, okay, you have a thyroid problem. Let me investigate. So I order a thorough thyroid workup that includes tests for autoantibodies, free T4, free T3, reverse T3, and TSA. This provides me with a comprehensive view of the situation. Thanks to these laboratory tests, I can determine whether you have low T4, a malfunctioning thyroid, T3 syndrome conversion syndrome, or anything else. Let's assume that I diagnose you with normal T4. But your T3 is really low, so what should I do? Well, to start, I want to do some follow-up testing, which I frequently already do, but let's say I didn't. I do follow-up testing, and I do nutrient profiles. I'll do a B12, folic acid, and iron panel. Those are the most important ones to see. Okay, maybe I have a nutrient deficiency that's causing this, and we need to address that. Then, I'm going to think, okay, what else is going on that could be causing this chronic inflammatory state that we just started earlier that could cause that T3 syndrome? I'm going to look. The T3 syndrome may be caused by heavy metal exposure, gastrointestinal issues, food allergies, small intestine bacterial overgrowth, and so on. I'll check for chronic infections like Epstein-Barr virus and see if you're overly exposed to pesticides, herbicides, glyphosate, and so on. These inflammatory states may also contribute to the T3 syndrome. However, while I treat these underlying causes, I frequently prescribe a glandular thyroid like Armour thyroid or something similar. Or if I feel that the condition is severe enough, I'm actually giving them T3 on its own. Either a gradual release or cytomel T3 or whatever I believe will work best for that patient in order for them to feel better and for their cells to function properly, allowing them to easily overcome any nutrient deficiencies that may be the root of their condition. Although I don't prescribe a T3 to help them, I frequently see patients in my practice who are extremely ill and have numerous issues. We need to address all of these issues because the patients can't overcome them because their immune systems, cells, and mitochondria won't function properly if they don't get enough thyroid hormone. In order to ensure that their cells are functioning properly, I'd always like to give them T3. Once these causes are addressed, we start weaning them off of the T3 or any other thyroid medications they may be taking. However, it is possible for someone to eat a very nutritious diet and yet have 100% nutrient deficiencies. It's possible that they're consuming food that has been depleted by the common soil, but more likely, it's likely that they have some sort of gut inflammation that prevents them from properly digesting their food and prevents them from getting enough iron, B12, zinc, or other nutrients that we discussed. People with Hashimoto's disease or Graves' disease frequently have poor conversion from T4 to T3. Depending on the patient's condition, this means that even if they have normal T4, their conversion to T3 may not be appropriate. What is the number to tell you if you are actually low in T3? For example, if your laboratory test results show that you are low in T3, that's very low. However, I even consider 2.5 or lower to be low in T3. And I frequently prescribe medication based on that if the patient exhibits the symptoms of hypothyroidism. The figures I just mentioned pertain to free T3. I rarely order total T3, as there is a lot of protein attached to it that isn't actually released. Instead, I always order free T3, and the figures I just provided are based on your desire to contact me or learn more about your thyroid condition. In conclusion, while low T3 with normal TSH and T4 levels can seem confusing, it's an important thyroid phenomenon that requires proper understanding and monitoring. If you're experiencing any symptoms or have concerns about your thyroid, it's always best to consult a healthcare professional. At Health Angel Solutions, we're committed to bringing you reliable health information to help you stay informed. If you found this video helpful, don't forget to like, share, and subscribe to our channel for more health tips and solutions. Thank you for watching, and stay healthy.